a time. We're not going to do it the whole time. So as you can tell, we're going right up to 11:30 today. I so apologize. My life is just off the hook right now with just odds and ends. So I'm so sorry about the recording. Oops, I got bumped out again. The recording was supposed to be easy peasy. All I had to do was record and it would post. If not, I just had to like click and post it, and nothing worked. I worked with IT, and that's why I was saying if you needed to see that, I was going to have to just log on and open it for you. So hopefully nobody has to miss any future classes, because the recordings are just a pain. And I talked to Miss Simmons, she said the same thing. She's had to have people from systems download it, put it in a different format, send it back, and it takes sometimes a week, 2 weeks for them to do it. I had no idea, because that's not what I was told was how it would work on Zoom. But anyway, on to today. So instrument classification. Periodontal instruments are divided into 2 types or classifications. And this is where we stopped last week. Assessment instruments are your explorers and your probes. Excuse me. Light touch. The handles are thinner or hollow. Sorry, the handles aren't thinner, but they're hollow. The ends of these instruments are fine. Shanks and fine ends, like the explorers, are practically a wire, so that you can feel. So everything's light, thin for feeling. Calculus removal instruments have heavier shanks, and they are for deposit removal. So you can feel some, especially as you develop your tactile sensitivity in your fingertips. You can even explore with these to feel moderate deposit. You would still go back with an explorer to do a final check, but they are not for assessment, they are for debridement. So they're heavier. The grip that you use for the debridement stroke is firmer. So this is back to week 2. There's a handle, there's a shank that attaches the handle to the working end. All this is a review. It's recommended that your handles are large so that your grip doesn't have to be teeny tiny. You have a larger instrument handle to grip. It's easier on the muscles in your hand and arm. That they should be light. They should have some texture for gripping, so you don't have to grip it really hard so it doesn't slip. So that's just general information of ideal. A review of what a shank looks like. It can have multiple bends, hooks the working end of the handle. There's a portion of the shank that is only for the purpose of attaching to the handle. The functional shank is where the first bend or curvature of the instrument starts, and it goes right up to the working end. The terminal shank is the last bend in the instrument. So when some of you were working with your 17 Explorer yesterday, we talked about how you have a working end and then it's in like a 90-degree angle. And that little portion of the shank, which actually is a pretty tall portion of your 17 Explorer, you can't see this because it's so dark, is your terminal shank. So it's just, whatever the last portion of the bend is your terminal shank. So you need to know these terms. A simple shank is straight. That's for anterior, right? And you got to see that with your 17 Explorer and your 11-12 Explorer. I guess no matter where I hold these, you can't see them. So your 11-12 has curves to it. That allowed you to adapt to the back teeth. Where your anterior Explorer, if you have the point of the anterior 17 Explorer and the point is facing you, you will see that the shank does not deviate right. It does not deviate left. It has a bump in it, but it's back and then forward. It does, and that's with the point facing you. If you look at your 11-12 and you take the point of the instrument with the handle up and down facing you, you will see that the shank veers left, or if I flip it, my terminal shank bumps out to the right. It goes in and out too, back and forward like a simple shank, but a complex shank will have a bump out to the right or left. And that's what this next slide is showing you. This is like your 17 Explorer, and the complex is like your 11-12. If you have the point facing you with the handle up and down, you're going to see it veers left or it veers right. If you see that, you know that instrument can work on back teeth. That's a posterior tooth instrument, premolar to molar. If you see a straight shank, it can veer forward and backwards, but not right or not left. That's an anterior only instrument. It's called a simple shank. So this is showing you your facial and lingual view of your simple shank. Here is your complex shank. And we worked with the 11-12 yesterday, adapting that shank to the instrument to the tooth. So you get a pretty good visual of what that right and left bend is doing. It's allowing you to adapt to the tooth in an ideal position. And this becomes even more critical with a debridement instrument because you've got to get the right blade on the tooth. Otherwise, your angle to remove deposit is not going to be correct, and you're not going to be effective. There are, you in all of your kits right now, I believe you have a standard shank length. Here they're calling it short, and that's what they're showing you in the green here. This is a standard shank. Most dental offices, most of their instruments are standard shank. Your second year kit will have a 3 millimeter longer shank on all of the calculus removal instruments, all of your curettes and most of your sickles. It will be 3 millimeters longer because if there is bone loss in a 6 or 7 millimeter pocket, you need this length of shank to stay in that same position to go further up or down, talking maxillary mandibular, into the pocket. It takes more instrument because you have to go further in a 6-7 millimeter pocket to remove deposit. So that's what